All right. Well, good evening. This is Mrs. Ignacio. I am with a graduate nurse, and we are going to be going through an NCLEX, next generation style NCLEX question together. All right. So let's begin. Okay. Monica, do you want to kind of walk us through what you see here about our patient?
Yes.
Thanks.
Um, it says my glasses is dirty. Let me use my
Let me
eyes.
let me try to make it bigger. Sorry, I know it might be small. Okay, how's that?
It's better. Better.
Okay, thanks.
They won at think let me say 10 o'clock, 10 a.m. A 68 years old male client present for a routine check clinic appointment. Reports tingling easily when one shopping when out shopping or for walks, has been staying home reading and watching television, report difficulty sleeping, awakes with shortness of breath in the middle of the night, report 8 pounds weight gain over past 2 weeks. Wow. Since last appointment, state normal appetite, denounce chest pain and back pain, state he's anxious about his condition, no known allergies, current medication, enalaprine 20 milligram twice a day, PO, hydrochloro dexedrine. Okay, let me know more than that. 25 milligram twice a day. Dix, diguzine,
The Jackson. Mm-hmm.
doctrine 0.12 microgram once a day, PO. Assessment as follows: alert and oriented times 4. Appears slightly anxious. Heart rate regular at 102 and 4 plus papillin petex and protibial edema.
Mm-hmm.
RR unlabored. Crack, crackles in basic bilateral
Mm-hmm.
abdominal soft, non-tender, bowels sound active, skin warm, dark and dry and intact, frequent urination, small amount clear yellow urine. Then the vitals was at received was the temp was 98.6 Fahrenheit, pulse was 102, respiratory was 22, BP was 170 over 100. The pulse oximeter was 93 on air room. He weighs 250 pounds.
Mm-hmm. Okay, awesome. Okay, thank you. All right, let's break this down. There's a lot going on with this patient, right?
Yes, ma'am.
Yes. Okay. So every time we get this kind of case study on the NCLEX, and we're going to have three case study questions, and each of these case studies is going to have six questions attached to it, and it's going to be unfolding. So we always want to make sure that we check for new notes, new tabs that have new information, new orders. And so, of course, this is the first question. So we're really just getting to know our patient. And I would submit to anyone that's, doing these kinds of questions, close your eyes and act like you're walking into the room. You see the patient for the first time, and everything that's inside of the question, you just see a patient in front of you. So when we see this 68-year-old male, he's in the clinic. So I just imagine, okay, a geriatric patient that's walking in. And now he tells me that he's tiring easily when he's out shopping for walks. When somebody tells you that, what do you start thinking about?
Um, Tired when walking has to be like maybe he's coming up with something like he's having an MI.
Okay.
or
Mm-hmm.
might due to the weight gain and he needs to like reduce some weight.
Okay. All right. So those are possible things that you could be thinking, right? Just based on that sentence alone. And so I'm thinking, is he breathing okay? Or is it a heart issue? Right. So those are the things I'm thinking. Maybe he has gained weight, right? So you're right. So these are great things when the patient tells us this. And of course, we're listening, but we're also critically analyzing all of these bits of information. We're looking out for clinical cues. He says he's been staying home reading and watching television. So this tells me, and you are right, right, that he's probably gaining weight because now he has a sedentary lifestyle. He's not going out walking as much as he used to. Okay. The next thing he says, he reports difficulty sleeping. Okay, that's going to be a problem because we know if a patient is not getting enough sleep, it could be hypertension. If they get up in the middle of the night, that could be what's going on. It could be insomnia. It could be stress. There's so many different reasons why the patient has difficulty sleeping, right? But then he says,
Yes.
awakens with shortness of breath in the middle of the night. What does that make you think is happening?
Um, Shortness of breath. I'll think he's kind of having like a heart attack or something.
Well, not necessarily heart attack. And here's the thing, because he's still able to function like the next day. So he has this
Mm,
shortness of breath. So it could be respiratory related, like maybe it's asthma, or it
okay.
could be heart issues. It could be heart issues. So let me show you a picture just for a second. And this picture might help, especially if someone is like a visual learner. And what this gentleman is describing, I'm going to bring this picture over. You should see a picture of left-sided heart
Oh,
failure.
mm,
So
yeah, that
this,
should be
what do you think?
um um it's not it's not COPD, it's think CH, uh, coronary heart
Mhm.
disease.
Yeah. Okay, do you
That's
see
one.
the picture that I'm sharing of the screen? I don't know if you can see it. Let me know.
Yes, he's sitting down. It's
Yes.
kind of bending. Yeah,
Yes.
look.
So what this gentleman is describing, our patient is describing waking up with shortness of breath. This is paroxysmal nocturnal dyspnea. So he wakes up in the middle of the night, not able to breathe well. Okay, so this is what it's kind of leading me to, because if the patient has paroxysmal nocturnal dyspnea, they're sleeping and they feel like they're possibly drowning in their own fluid. And that is a clinical cue that leads me to think maybe this patient has heart failure, particularly left-sided heart failure, because left means lungs, right? And
Yeah,
so here's some other symptoms that he may present with, and these are the clinical cues, right? So let's go back to our patient's notes and see what else we find. Okay, so he's got difficulty sleeping. He's awakening with shortness of breath in the middle of the night. He reports 8-pound weight gain over the past 2 weeks. Is that a significant amount of weight?
that's a lot.
Yes, in 2 weeks. So that's 4 pounds a week. So that's
Mm-hmm. It's
so
important.
that's concerning, right? Okay.
Yes.
His appetite is normal and he denies chest pain and back pain. So when you mentioned the MI, he would probably have some chest pain. Okay, if he was
Mild.
having it, right? Or if he had angina, but he's denying that. Now, he states that he's anxious about his condition. Okay, so that means that his stress is up. Okay, He's worried. He doesn't have any known allergies, so he's free to take medications as the doctor prescribes. Current medications he's on: enalapril, 20 milligrams twice a day by mouth. And what kind of medication is this enalapril?
Enalapril. 1 minute. That should be, I think it should be one of the beta blockers.
So
If I'm not mistaken.
enalapril is used for congestive heart failure, and it's an ACE inhibitor. An ACE inhibitor. The LOLs, I think you're thinking of the LOLs as beta blockers, I
Blockers.
believe. Yes. Okay. So when we think about enalapril, we know that it's an ACE inhibitor, and the things to think about, like the serious side effects of enalapril, would be breathing troubles, liver troubles, central nervous system troubles, kidney troubles, potassium we have to look out for, um, angioedema. And I was just listening to Kathy Park's video today, and one of the things she did mention with the prills is that angioedema. And when the patient has angioedema, we have to look out for swelling of their
Yeah.
face, their
Yes.
throat, right? Their tongue and lips, eyes, hands, and feet. And that makes me concerned about their airway, right?
Yes.
Okay, so just kind of breaking it down. And then he's also on hydrochlorothiazide. Hydrochlorothiazide. So this tells me that this patient has a history of hypertension,
Yes.
and he has a history of edema, right? Because this is going to be one of your thiazide diuretics. Okay. So hopefully we're kind of painting a picture of what this patient looks like, right? Um, and then he's also taking digoxin.
So,
Digoxin is a cardiac glycoside that actually helps the heart to beat more forcefully. And so thereby it's also going to make the heart beat less times per minute. And so that is that one of the medications I'm thinking, okay, I have to look out for digoxin toxicity. I have to make sure that the heart rate is at least 60 per minute, right? Checking that apical pulse, left midclavicular line, fifth intercostal space, right? Those are all the things that I'm thinking. Now we assess the patient, and what do we find? Alert and oriented times 4. That's reassuring, right?
yes. But the
Okay.
heart rate, the pulse is, the heart rate is really high.
Yes. So we have tachycardia. What about this edema? Are you concerned about
Edema, yes.
this?
Yes, from the analuprine that would give him the edema.
Yeah, so and I'm just going to bring up a picture of edema in case somebody later on is going to look at this and they may not be familiar with edema. The fact that his edema is +4 is
That's a
really, yeah, it's concerning, right? So
and
here we
see
have, can you
poison.
can you see it?
Yes, ma'am.
Yes. Okay. Perfect. So the one on the left, that's +1, and then as we move from left to right, it increases, right?
8 and 8.
S. And so +4 is really pretty serious, okay, on the pitting
I'll
edema
take time
scale.
to, yeah.
And so now I'm going to ask a question. If he's taking this diuretic, right, the hydrochlorothiazide, and he still has a +4 edema, is that concerning?
It is because it's like it's still retaining. And
Yes.
the urine sample they got from him wasn't much either.
Mm-hmm. Excellent. Okay, very good. So we'll go back to this patient and we see that he has this on his feet and by his tibia. Now, his respiratory rate is unlabored, right? So that means he's breathing, he's not using accessory muscles, but he's got crackles in his bases. Oh, wait, let's go back and look at our left-sided heart failure. One,
The
one of the cues or one of the symptoms is going to be crackles, right?
crackles. Yes.
Okay, so we're painting a picture of what's going on with this patient just by this note, okay? And let's see, crackles in his bases bilaterally. So he's got wet lung sounds. His abdomen is soft and non-tender, so that's good. His bowel sounds are active. His skin is warm, dry, intact. Frequent urination. Well, we know that he's on that hydrochlorothiazide, and that would make sense that he's going to the bathroom to
Mhm.
urinate. But the fact that he still has all of that edema is a
And the
little concerning, right?
concern, yes,
Mm-hmm.
it's not
Okay.
taking his medication frequently or something.
Mm-hmm. Or he has something with his urinary system because it says small amounts of clear yellow urine. So the fact that his urine is clear, that's reassuring, but the small amounts, I have to see what's going on with that. Okay. So,
It's,
his pulse you already mentioned was tachycardia. His respiratory rate is elevated. What do you think about his blood pressure?
it's too high, really high.
It is high. I am concerned about that. Okay, so we did a really good breakdown, and I know we're just taking our time because we're not necessarily taking the NCLEX right now, but this is a good way to break down these cases when we get them and really peel back the layers and say, okay, what's going on with this? What are these cues telling us about the patient? Okay, so the question now is asking which of the four findings are most concerning. Okay, and I'm going to give you some time to read that. Um, and if you need to see the note again, let me know, but I'm going to kind of make this bigger.
Yeah,
Do you need to see the note?
okay. No, 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 I'm
Okay,
good. I'm gonna
okay,
take the 4 points perfectly for the edema, the
okay,
crackles bilateral, um, the shortness of breath, and the weight gain.
okay. Okay, excellent. That is all of those are correct. So those are the four that are the most concerning. Okay,
Yes.
so kind of walk me through what was your thinking? How did you get them all correct so quickly?
Because when we were doing the questions, I was looking at it, and we said about the edema because it was there. Maybe something is wrong because with the medication, the hydrochlorothiazide was supposed to be paying, but he wasn't paying that much. Maybe he was paying that much, but something is wrong with the system. And there was a crackles on
Mm-hmm.
his bilateral lungs, which we were talking about. One of the legs left side effect of heart failure,
Mm-hmm.
waking up with shortness of breath, which is like part of still one of the signs of heart failure and with respiratory issues, and the 8 pounds within 2 weeks is just too much.
Yes, excellent, excellent. So yes, okay, so you got it, okay? And so I would submit to you the same way that we kind of broke this down is the same way that whenever we see these next generation case studies, we should really take time to analyze it. And the more you do them, of course, the faster you're going to be, right? Because I know this took us some time, but for NCLEX, if you keep practicing, it's going to become second nature to you. Okay, it's going to become second nature. Okay, so let's go to the next question because there's 6 questions. And whenever we have these questions, it's always good to look for new information. The way this particular system is set up, there's not tabs, but like for those that are testing, taking it on Evolve or something, maybe they're doing a different system like UWorld or something, there's going to be tabs that they would be able to
Mhm.
click on. So we can't necessarily click on tabs here, but we're just checking to see if there's any new information. And it looks like there's no new notes, no new
That's
vital
new information.
signs. Okay, so let's go to the question. And it says, drag the most appropriate words from the choices to fill in the blanks of the following sentence. Two total, one for each block. Okay, so what is this really
So,
asking us?
um, what do we like diagnose was is wrong with the patient?
Yes, right. So the two problems that the client is most at risk for developing based on what we have seen.
I think one of them we said it was heart attack, and the other should be the I don't want to say. I know the flow overload was one of them, but it should be um yeah, that should be it. But right now, we don't know I don't know any of any more because going by the sentence up, that was the two we're thinking should be wrong with him.
Mm-hmm. Okay, I will tell you that you're halfway there. Okay, and the one that is correct is the fluid volume overload. And you
Okay.
noticed that right away with the weight gain, and that's a significant amount. You noticed about the edema, the pitting edema. But let's talk about the heart attack symptoms. Did this
Um,
patient have any symptoms of MI? Or let's actually, before I ask you that, let's go talk about let me see if I could show a picture, okay, of MI. What will the patient present with?
okay, there's nothing, there's no severe, no vomiting. The pulse that doesn't really make sense. Okay, let's go back. I've
Okay,
seen it. I don't have any of those things.
okay,
So
good, okay.
going back, um, um, do we say thrombosis?
Oh,
No,
thrombophlebitis.
uveitis, yes.
So that's going to be an infection of the vein because they have an IV that has gone bad.
He
And
doesn't have any and nothing yet.
no, he doesn't have
So
any
like
IV, and there would be redness and warmth
yes,
at the site. So not that one.
that one. He's not dehydrated because there was nothing like dehydration there.
Uh-huh, that's true.
Anemia, I don't think he has. Mm, let's do electrolyte imbalance.
Okay, so interesting. Why did you choose electrolyte imbalance?
Um, because when we go back to the question, he can you take the question for upward a little for me?
Okay, yes. Can you see what you need to see now?
Yes, yes, I can see.
Okay, perfect.
With the medications, there is something should be wrong with the medications. It's like either he's not taking it the way he was supposed to take it, or he has something coming up with him.
Okay, so it sounds like you're saying his medication regimen is not effective in managing his condition.
Yes,
Right.
ma'am.
Yes. Okay. And so I agree with you because if his medication regimen was good for the patient, he wouldn't have this edema. He wouldn't have, these small amounts of urine frequently, right?
Yeah.
So that I agree with you. I definitely agree with you. And whenever I have a patient taking a diuretic, I also want to look out for fluid electrolyte imbalance, right? That's one of the things that goes with that class of medication because they're going to be diuresing, releasing that extra fluid. Okay, and so you are correct. So this patient is at risk for electrolyte imbalance and fluid volume overload. I'm going to try to put the rationale on the screen. Let me try to get a text box here. We talk about the rationale. So the client has worsening heart failure and is at risk for fluid volume overload as evidenced right by the weight gain, by the edema, and they're also at risk for electrolyte imbalances from hemodilution. Because of this excess fluid, the blood is diluted. Okay, he is also taking hydrochlorothiazide and may become hypokalemic if he's not including enough potassium in his diet. And that makes sense, right? Based on what we know about diuretics, I'm always concerned about the patient's potassium level. If it's too high or if it's too low. Too high, I would be more concerned if it was a potassium sparing diuretic, right?
Yes.
Okay, perfect. So he is at risk or low risk for hyperkalemia, dehydration, anemia, heart attack, diabetes mellitus, and thrombophlebitis. And you said he doesn't even have an IV site, so that shouldn't even be a concern. He just came into the clinic. Okay, all right, super. Any questions so far?
No, ma'am.
Okay, all right. So good discussion. I like what you're talking about and how you're breaking it down. So that's great. Okay, let's go to the next question, which is question number 3. And of course, we're
Oh,
always
lab.
looking for notes, same vitals. Oh, but you're right, there's labs. Okay, so look at the labs and you can talk it through if you want or tell us what you think.
The lab. The weight, there was a concern on his cholesterol is high, it's on the high side,
Mm-hmm.
and his creatine is a little, but that doesn't show more concern. The main concern, this is good. This is good. His potassium is low. That's a red flag.
Mm-hmm.
Sodium is okay. So the main concern right now is the potassium.
Okay. And so you're saying the abnormal lab the nurse should address first is potassium?
Potassium, yes, please.
Yes. Okay, that is correct. That is correct. And so I'm going to put the rationale on the screen. Let me get the rationale there. And so I'm going to tell you, whenever my patient is taking a diuretic, I always worry about their potassium. And
Yes,
I
because
feel
they
like
always
I'm,
pee it
Mhm.
out.
Say that again, please.
Because they always pee it out or they are retaining. It
Yeah.
should be one of them.
Yes, right. So I'm always looking out for hypokalemia or hyperkalemia, depending on what kind of diuretic the patient is taking. So you're 100% correct. Now, the serum potassium level must be addressed first. It is dangerously low and can precipitate digitalis toxicity. And that's one of the things that when I was listening to Kathy Parks today, she was talking about digoxin, and she really harped on the fact that low uh, um, potassium, that hypokalemia, is very concerning for a patient that is on digoxin. Okay, and so because it can lead to this digoxin toxicity. Now, the cholesterol is high. It's not an issue that has to be addressed right now. And the hematocrit is slightly low, but we know that he has fluid volume overload. So that's kind of expected. The creatinine is within normal range, a little on the higher side, but it's not urgent because when we think potassium, we think something may happen to the heart, right? We want the heart to be in a normal rhythm. Okay. Any comments or questions about this question?
No, ma'am. No, ma'am.
Okay. All right. Super. All right, let's go now to the next question. Okay, so this is question 4. No new notes or vitals, labs are the same. Okay, so here's an extended select all that apply because there's a lot to think about. So I'm going to let you read through and tell me what you think.
Teaching plan for these patients. Select other plan. Weigh yourself every day at the same time and in same clothes. That should be right, yes. Increase intake of fluid to stay hydrated. No, already have excess. Limit sodium in the diet and no more than 2 grams a day. Let me leave that one first. Immediately report 1 weight gain in a day or 3 in a week. Yes, that's it. Limit exercise and physical activity. No, they want him to be active. Take prescription every day, even if feeling better. Yes. Eat high potassium food. Yeah. Yes. And let me go back again. Need sodium. It doesn't need sodium. Sodium is okay. Increase. No, that should be it. If I'm not wrong.
Okay, so these 4 choices are your answers.
Yeah.
Okay, so these are your answers.
Yes, ma'am.
Okay, all right, great. So you're almost there. You're almost there, right? And so I'm going to bring up the rationale and we're going to talk about each of these. So all of the ones you chose were correct, right? So
Yeah.
weigh yourself every day at the same time in the same clothes. And I would also add a little extra probably first thing in the morning after they empty their bladder, right? That's going to be the standard for weighing patients.
Yeah.
So that is correct. Increase intake of oral fluids to stay hydrated. Well, you said it correctly. This patient has fluid volume overload. They don't have to increase any intake of oral fluids, okay? They don't have to worry about being dehydrated at this point. Limit sodium in the diet to no more than 2 grams per day. Why would we tell the patient to limit their sodium?
But sodium is not good. With sodium, they want to drink a lot of water. So,
Okay,
yeah.
that's true. You're getting on the right track. But okay, so what is part of a heart healthy diet?
Low sodium diet.
Low sodium, right? And we know that this patient already has hypertension. We saw his blood pressure 170 over 100. And
Very good.
so I would tell this patient to limit their sodium. They do need to be, oh, sorry, they do need to be on a low sodium diet. I would probably additionally say they probably need to be on the DASH diet. The DASH diet is the dietary approaches for stopping hypertension. You ever went to the supermarket and you saw Mrs. Dash, the seasoning?
I use it at home.
Okay, good. I do too, and it's actually pretty good.
Yeah.
So, excuse me, so that is correct. Let me just, okay, so I would check limit sodium. And then you got this, the other's correct. Immediately report 1 pound weight gain in a day. And we know that 1 pound is equal
2.2
to, yes, 2.2
kg.
um well, 1 kilogram is 2.2 pounds,
Two.
right? And it's 1 liter of fluid.
Wow.
So that's yes, and that's the key. That's what the key when we think about the 1 pound, 2.2, right? We think about 1 liter of fluid, and that's a lot. Okay, and that's what we're seeing with this patient. It makes sense that he's gained 8 pounds and he's got this 4+ edema. Okay, so yes, and then you said it right. We don't want to limit his exercise and physical activity. We want him to actually
Okay.
increase.
Yeah.
Okay, excuse me. And then you said about the medications, take them every day. That's true. And eat foods high in potassium. Yes, that is correct. Okay. And so I'm not sure if I said the right thing earlier, but 1 kilogram is equal to 2.2 pounds, equal
Yes,
to
ma'am.
one liter of fluid.
Yeah, you said
Okay.
it right.
Okay, great. I just wanted to be sure. Okay, let's see. Let's look at the rationale. The client is experiencing an exacerbation of heart failure and must be taught self-care measures, including daily weights, limiting dietary sodium, increasing potassium-rich foods, and taking medication as prescribed. Are any questions about this?
No, ma'am.
Okay, awesome. Let's go to the next one. Oh, let me clear that. Okay. Oh, we've got some new notes here, right?
Yeah.
Okay, so you want to read that or?
At 10:30, ordered to discontinue detoxing and began sa sacobatry. Let me write this down. They gave him two new medications.
Mm-hmm.
What is 49/51 p.m.? That's a medication dose.
Yes, so 49 milligrams of sacubitril and 51 milligrams of valsartan.
Okay. PO daily along with nutrition/dietary consent. Began low diet and low sodium diet and flu restriction to 1 to 1500 meter 24 hours. Instruct to weigh himself daily and report to the clinic in 3 weeks. Follow up. Let's see what that medication does.
Okay, yes, and I'm gonna put a little chat box so we could talk about that medication. Okay, let me see, because that's a really great question. Okay, so this medication is a combination, sacubitril and valsartan. It's a combination of medication that's used for blood pressure. And so
Okay.
this helps our patients with chronic heart failure. So chronic mean they're going to have it for the rest of their life. It develops over a period of time, right? There's no cure, right? And so this lowers the patient's risk for needing to be hospitalized. Okay, and so um, let's see. What else can I tell you about this medication? This medication is not good for kidney patients. Okay, it's not good for pregnant patients either. Okay, and for children, this medication is based on weight. Okay, based on weight. Okay, what else can I tell you? So that's a little bit about it. Um, let's see what else. Any questions so far about this new note?
No, ma'am. No.
Okay, and it kind of makes sense, right? They're not saying anything that is going to make us question anything. It makes sense. All right, so let's now go and see. Okay, lab reports the same. So the question is asking, which of the following actions should the nurse take in response to the change in the medical orders? Select all that apply.
Question the new medication. No. Educate the patient about the stopping of yes. Instruct the patient to start the new drug today. Yes. Tell patient to take an additional dose of no. I was included. Request that the provider order potassium supplements. They didn't say. Can you go up a little? Let me see the notes.
Mm-hmm.
Okay. Begin low sodium. There was nothing like potassium. No. Go up,
Okay,
please.
go. Okay, so back to the question.
That's one.
Okay.
There was no additional for potassium supplement because they want him to eat something that will boost it up. Ask for dietary to meet with the client, yes.
Okay.
Then determine if the patient own a scale. Yes. Ask if he has a scale.
Okay, I selected 4 items. Are those the ones that you are choosing?
Yes, ma'am.
Okay, awesome. Let me see. So a good chunk of it is correct. Let me before I put the rationale, because it won't let me do one thing at a time. So we're going to question the new medication order because they did not stop or discontinue the enalapril. Okay,
Okay.
so that is a little bit of concern. And the new medication, I'm not going to let them start that
Both
new
of them have
medication.
the same effect.
Yeah, so because that is also an antihypertensive. So if they're taking too many antihypertensives, now I'm concerned about hypotension. Okay. And I would request a potassium supplement because the potassium is so low, right?
Okay.
All right, let me put the rationale up here so we can talk about it a little bit. So you got most of them, and that's good. And so this kind of question is on the plus minus scale. So you would get correct if you chose like correct choices, but if you chose something that was incorrect, which did you? I think maybe one of them, then you would lose 1 point. You would lose 1 point. So here we go. So the new medication order should be questioned as the patient is already taking enalapril, okay? Because that medication is a combination for heart failure and it includes like blood pressure medication, like the patient's blood pressure is supposed to decrease with this. So we're concerned about hypotension, okay? Educate the patient about stopping digoxin. That's important, okay? And so let them know that they're going to be stopping it. That so make sure that they understand that part. Let's see, a consultation with the clinical dietitian is needed to teach the patient about his fluid restriction and potassium-rich foods to add to his diet. And what are some of the examples of potassium-rich foods?
Potassium rich food. I know banana, spinach, um,
Mm-hmm.
broccoli, think liver was it liver included? I know I was listening to something like that this morning. Was liver?
I want to say liver is for iron. Let me
Oh
see.
yes, liver is for iron. Yes, thank you. That's for
Y-
iron. Okay, I know I
Yes.
listened to you this morning.
Okay. Yep. So you're right. So bananas, oranges, cantaloupe, honeydew, apricots, prunes, raisins, dates, they're all high in potassium. Spinach, you said broccoli, sweet potatoes, mushrooms, cucumbers,
Mushroom.
zucchini, pumpkins, leafy greens. It sounds so good. Orange juice is also high, tomato juice, prune juice, apricot juice. Yes, okay. Some fish also contain potassium, like your tuna, halibut, codfish, trout, rockfish, but that codfish is really salty, so I probably wouldn't tell the patient to have this one. Okay, awesome.
Catfish.
Yes,
Yes,
codfish.
high in potassium.
Hmm?
Wow, I never knew it was high in potassium. I said I never knew catfish was high in potassium.
Yes, codfish, not catfish. I'm not sure if you said codfish or catfish. But yes, codfish is high in potassium.
Okay.
Yeah. it has potassium in it, but I don't think that that's going to be enough. Like if the patient says, "Okay, I'm not going to have leafy greens, I'm just going to eat these fish." I don't know if that's going to cut it. And also the thing with tuna, like you can't have too much of it. You can't have it every day because of the mercury levels too. So that's a whole nother thing. That's a whole nother thing. But yes, so
Yeah, but
tuna,
veggies should be better anyway. You can mix them up.
yes, that is true. He's got a lot of fruits and vegetables to choose from. All right, awesome. Any other questions or comments on this one?
Oh, ma'am.
Okay, awesome. And thank you for taking the time to go through these. We've got one more question that goes with it. Okay, all right. So there's definitely new notes. I'm going to make it
Oh,
larger. Okay.
okay. Client called clinic to report nagging cough, pink, target sputum, and difficulty catching his breath. State he's sleeping in a recycler recliner because he can't breathe when he's laying down on the bed. Notes that wife checked pulse and it was 90. Report lack of appetite, taste, and getting up twice per night to urinate. States he's worried about his health. Advise clients to that worsening symptoms need immediate attention. Speak with client's wife who agrees to take him to the emergency room. Yes, I know you questioned that the medication because one wasn't discontinued. So that is it. He's now
Mm-hmm.
having the difficulty breathing and it's becoming too much for him to take.
Mm-hmm.
But his pulse wasn't bad though. The pulse was okay. The BP, she didn't say anything about the BP.
Right. She didn't.
And the urinating twice at night, it depends on the volume that he pulls out.
Mm-hmm. Okay.
And
All right.
he reports lack of appetite and taste. So which means he still drinks more. They only pee twice at night.
Mm-hmm. Okay.
That's a good sign. That's a concern.
Okay. I'm gonna go back to this because you're saying some interesting things. Let's go back. And so one of the things that is being described is the fact that he's sleeping in his recliner.
Recliner,
And
and
so
that's not good. That's restless.
right. And so that is orthopnea. When the patient has orthopnea, they can't sleep lying down or reclining. They have to be sitting up. And it could be over pillows, it could be over the bedside table. In his case, it's with the recliner. Okay, so this tells me that this patient's condition is not improving, right? It's not improving. And the advise the client that worsening symptoms need immediate attention, and now she's taking him to the emergency room. Okay, and so we also see that he has a nagging cough, pink tinged sputum, and difficulty catching his breath. Let's look at this guy. Does this guy show us that these symptoms, signs and symptoms?
Yeah, I think the cough. And but that one he said it just spewed but this one has a bloody
Mm-hmm. And
blood.
so yeah, so you're right. So blood tinged sputum or pinkish sputum, the crackles, the coughing, the tachypnea, the difficulty breathing, right? That is all a part of this, okay? So now he's headed to the emergency room. This is day 14, okay, of what has happened. Day 14 in the morning. All right. So we've been going through this for 2 weeks. All right,
Yeah.
so not good. So over 2 weeks, his condition is worsening. So on day 14, the nurse calls the client. For each finding, click to specify if it indicates the client's status has improved, worsened, or unchanged based on his visit 2 weeks prior.
Yeah.
Okay.
Sleeping in recliner, worsen, nagging
Mm-hmm.
cough, worsen, tingling, pink tingling sputum, worsen, difficulty breathing, worse, Lack of appetite worse.
Okay, I'm
20,
sorry. You said pink tinge sputum worsen, difficulty catching breath worsen, right? Okay.
um,
And
yes.
and then for pulse, okay.
Pulse is okay. It's okay. It's improved. The
Okay.
pulse improved. The lack of appetite worsen
Mm-hmm.
2 times at night. The first one, they didn't specify how many times it goes to bed at night the first time.
Mm-hmm.
But there
Well,
was an edema, which was,
so let's take a look at it and see.
yeah,
I'll give you a moment to look at it to see if he
yeah,
was getting up
first
at night.
sleep middle of the night, woke up. But he never specified. Noise, just pain. He never states how many times he goes to the bathroom. He didn't state how many times he used the bathroom at night, which means he wasn't even going at all at night then.
Mm-hmm. Because they don't mention it.
They didn't
Okay.
mention it.
Okay. So what do you think then? Gets up at night to urinate.
I'll say improve because since he didn't state it, tasty worsen.
Okay. So thirst worsened.
Worsen, yes. Okay.
Okay. All right. So you did pretty good. You were on a roll, right? So you got most of them correct. Um, so let me choose the correct ones and then I'm going to put the rationale so we could talk about it. So
Okay.
sleeping in the recliner, yes, that's true, worsen. The nagging cough, worsen. Pink tinge sputum, worsen. Difficulty catching breath, of course. The pulse is improved, and that's true. You got that one. Lack of appetite, it worsened. Getting up at night to urinate actually worsened because they didn't necessarily say that he was getting up at night to urinate. He was getting up at night before because of the shortness of breath, but they didn't mention that he was urinating. But now he's urinating twice a night. Okay. So, and I know that, and I could have led you down a wrong track because when I mentioned the insomnia, I was talking about like there's different reasons why he could have insomnia, but it didn't say that. So I think part of it was my fault that I planted that seed. And I just talked about, let me see, what did it say? Reports tiring out easily, difficulty sleeping. And so I asked, okay, why could the patient have difficulty sleeping? So maybe I think partially that was my fault. So I'm sorry about that.
Okay.
Um, and getting up
That's
at night because I was just asking the questions. So I would say the warning is I know that I'm asking the questions and sometimes we ask ourselves questions, but stick with what's in the scenario. And I think when I'm breaking it down, I probably shouldn't give as many different things because that could be confusing. So I think that's my fault. So sorry. Um,
okay,
Okay. So lack of appetite worsen. Getting up at night to urinate is worsened because he's getting up twice now. And the thirst is unchanged. So no issues with his thirst. Okay, so let's take a look at the rationale. Okay, I'm gonna put the rationale up. Okay, so here we go with the rationale. The nagging cough, difficulty catching breath, sleeping in recliner, pink tinge sputum are all signs of worsening left-sided heart failure that require immediate intervention. Lack of appetite and getting up at night to urinate are also signs that the client's heart failure is worsening and his status is declining. He has reported previously that he was anxious about his condition, but now reports being worried about his health, so this indicates a decline in status. Oh, okay, that's good because he was anxious, but now he's worried. That's
sorry.
really significant. I didn't even pick that up. Okay, thirst is not related to heart failure. Pulse is slightly improved from clinic visits and is within normal limits. Okay, any questions about this one?
No, ma'am.
Okay, all right, so we're gonna stop here. Okay, let me stop. I'm gonna stop sharing and I'm gonna stop recording.